The Port Moresby General Hospital's ear, nose and throat department collaborated with a visiting Australian head and neck surgery team to perform complex procedures and deliver advanced training last week. Chief ENT Surgeon Dr. James Naipao explained that this partnership had been vital for strengthening local expertise. He noted that it supported the training of doctors and nurses, enhanced patient care, and built lasting healthcare partnerships.
We have 4 doctors and who are surgeons, and then 2 theatre nurses. Right, of the doctors, 2 of them are professors. So they're here to teach and pass the knowledge to the next generation of otolaryngology and ear and neck surgeons in the country, and they've been doing this, I think, since the 80s. Since the 80s, I think, pre-independence. I think we are a friend to Australia, right? So I think it is right that they've arrived here in Pmgh to at least set skills to the nurses, right? Skills to the doctors, so that at least partnership can drive, because we're all dealing with the sick and the health and service deliveries to mankind. So I think what they've done is very good.
Patients underwent joint reviews and surgeries were carried out on Tuesday and Wednesday. On Thursday, junior doctors received hands-on training in surgical techniques, while nurses joined specialized workshops that improved patient care. The visiting team was led by Professors Christopher Perry and Roger Grigg, supported by surgeons Dr. Campbell Schmidt and Dr. Robert Calvisi, and theatre nurses Kristen Berlin and Jess Edgehart. Together, they introduced advanced approaches to managing cancers and traumatic injuries.
It's also been fantastic to see, in 2 years since we've been back, the progress in the department. It's now probably the leading centre in the Pacific for ENT training, and each time we come here we advance that, and it goes a little bit further, and that's to the team he's got here, so that's amazing. This time we brought nurses who were able to work with the already very experienced nurses here, but teach both the theatre nurses and the ward nurses and the clinic nurses some newer techniques. Like all places in the world, there's an overburden of patients with too many patients and not enough doctors, and we all find that. But one of the areas that we specialise in is head and neck cancer, and that's very prolific here. And we've been able to hopefully teach some techniques that will help to reduce that burden and to reduce the suffering of, which is quite a difficult disease to treat anywhere in the world. And it's been fantastic to be here. We've got 2 amazing surgeons, and we just did an incredibly complex case on a very young lady, one of the youngest ladies I've seen with this type of cancer anywhere in the world, and we did it here in Port Moresby probably 2 hours faster than I've ever done it. So that shows you the full team, how amazing they were able to do. And that requires an amazing teamwork. We realised we put a fairly big imposition on the staff here, but they rose to the challenge, and you should be congratulated for the levels of expertise you have here, and the registrars and the nurses and the anaesthetic department, as well as the rest of theatre, for letting us do that. So.
Port Moresby General Hospital has reported a concerning increase in cancers affecting the mouth, head and neck among young people, and this medical visit has seen a couple of complex cases. Traditionally, these cancers are more common among older individuals. Alarmingly, doctors are now diagnosing patients as young as 18 and 19 with similar conditions.
Is the high incidence of cancer of the mouth and throat associated with smoking smoking very powerful cigarettes and chewing betel nut from a very young age. I believe now 5 or 6 year old kids are starting to do it, and you drive past the markets now, instead of 2 or 3 sellers of betel nut and the lime and the mustard, there's 30 of them, and all making a profit because people are buying it for their kids. And it's a great shame. And the cancers, these throat cancers, when I first was coming here, they were in 40, 50-year-olds. And our first cancer was a 25-year-old. Our last cancer today was a 31-year-old. It's a distressing thing to see because they're so symptomatic and so ugly, and they don't kill people quickly. The big ugly things grow out of their face and their neck, as opposed to cancers elsewhere that are often hidden, and it's a great shame to see that happening. So a campaign against betel nut chewing and smoking is something that if you guys got together would be as powerful as Gardasil vaccination.
Pmgh CEO Dr. Paki Molumi expressed gratitude, saying the team's contribution in performing complex surgeries and delivering training had a lasting impact on healthcare services. The team has departed on Friday after a week-long of collaborative clinical work and training, reinforcing the strong partnership between Papua New Guinea and Australia in advancing healthcare services. Doctors are urging the public to remain vigilant and seek early medical attention for any unusual changes in the mouth. Maintaining good oral hygiene and reducing harmful habits can significantly lower the risk of developing these cancers.